Now you have completed the circulatory system, we can look at the respiratory system and how they are interdependent. One cannot really do its job without the other. We will look at the respiratory system's structures, functions, and why it's important to understand it. The relevant pages can be found in your manual in Unit 1, Section 9. We can breathe without thought. If we had to think about every breath we took, we wouldn't have time for anything else. The respiratory system is responsible for bringing oxygen, O2, into the body and expelling carbon dioxide, CO2. It is controlled by the autonomic nervous system, therefore we have no control over it. It's involuntary. You can, however, manipulate your breathing as practiced in meditation, Pilates and martial arts, among other things. But as soon as you forget about breathing, the body takes over again. All functions such as oxidative metabolism, which is the breakdown of glucose into energy at a cellular level, require O2 and create CO2. We don't just breathe it in and out. It is absorbed into the bloodstream, transported around the body, diffused into the tissues, and the waste CO2 is collected, returned to the lungs and breathed out. So why, as a sports massage therapist, do we need to understand the respiratory system? We can have an indirect impact on it. As previously mentioned, when we massage we have an intention. This can be to relax muscles, stimulate them, or encourage healing. So if our intention is to relax muscles, we will also relax the nervous system, stimulating the parasympathetic side of the PNS, which, as you may remember, is the rest and digest or calming side. This would be considered a physiological and neurological effect of massage on the body, and in this case the side effect is breathing will slow and calm. You will also impact the respiratory system by improving posture and muscle dysfunctions. This is picked up again towards the end of the tutorial. The structures involved in breathing are obviously the lungs, some pipe work. This includes the trachea, bronchi, bronchioles, and then muscles. In normal breathing, this would be the diaphragm and intercostals. In forced breathing, further muscles will come into play. The lungs are located in the thorax, beneath the ribs, providing them with protection. The heart is located between the lungs, just slightly left of centre. As you will remember from the cardiovascular section, the pulmonary blood vessels connect the heart and the lungs together. Below the lungs you will find the diaphragm, which is attached to the ribs. The intercostals are found between each rib. The scalenes and SCM are found in the neck, while the abdominals are located on the anterior surface of the trunk. The main tube down the centre is the trachea, often referred to as the windpipe. This is constructed of cartilaginous rings, giving it form. Branching off from the trachea into the left and right lungs are the primary bronchi, which break down into numerous small tubes called bronchioles, and at the end of each of these you will find the alveoli or air sacs. This is where O2 and CO2 exchange take place between the lungs and the bloodstream. This process is known as diffusion. Looking at the movement of air, we breathe in through the nose and the mouth. This passes through the pharynx, throat, then the larynx, voice box, into the trachea. It then divides into the bronchi, bronchioles, and finally into the alveoli. This isn't the end of the journey. It is absorbed from the alveoli into the bloodstream through the small capillaries that wrap around them. Both the alveoli and the capillaries are 1 cell thick, allowing ease of passage for gases. This is known as gaseous exchange. The blood then carries the oxygen around the body, where it diffuses into the tissues for use. And at the same time, carbon dioxide is collected from the tissues and is returned to the alveoli to be expelled from the body. What exactly is gaseous exchange? Simply, it is the movement of gases, O2 or CO2, from an area of high concentration to an area of low concentration. When considering the movement of gases between the atmosphere and the lungs, the movement is via a pressure gradient. So if there is far more O2 in the atmosphere around us compared to our lungs, we will draw it in, creating a balance between the two. The muscles involved in breathing help further with diffusion. On inspiration or breathing in, the dome-shaped diaphragm flattens, creating space in the chest cavity or thorax. At the same time, external intercostal muscles contract, raising the ribs and further increasing the chest cavity volume. This causes a negative pressure between the air in the lungs and the atmosphere. This will cause the process of diffusion to occur, drawing air into the lungs until the two pressures are balanced. This happens in reverse during expiration or breathing out. The diaphragm returns to its dome shape, the intercostals relax, lowering the ribs. This reduces the space in the chest cavity, creating a positive pressure, which diffuses the air back out. The requirement to breathe is mainly triggered by the raising levels of CO2 in the bloodstream and is controlled by the CNS. In particular, the pons, which controls the act of breathing, and the medulla, the rate of breathing. Both these are found in the brain, and you should remember them from your nervous system. If the signals from the brain were to stop coming through, breathing would cease. As a final note, there are several types of breathing. Costal breathing, which is shallow, so from the chest, meaning full lung potential isn't used, and you would only see the chest rising, not the abdomen as well. This is often common in those with a sedentary or desk-based lifestyle, or those experiencing stress, so potentially this is an area sports massage can have an impact. Costal breathing is not an effective way of breathing and means the lungs are not being used to their fullest potential. By helping to reduce the stress and improving your client's posture, you will have an impact on the respiratory system. You then have diaphragmatic breathing. This is deeper breathing, often practiced in yoga, Pilates and so on. This will involve the diaphragm doing its job and will pull more air and therefore more O2 into the lungs than costal breathing. Finally, forced breathing. So this occurs during heavy exercise when the body is demanding more O2 than you are offering. This is when the scalenes, sternocleidomastoid and abdominals come into play, creating even more cavity space by assisting in the movement of ribs upwards, therefore creating a larger negative balance, meaning more O2 is diffused in. This leads us to one last area a sports massage therapist can help within the respiratory system. Many therapists have little regard for some of the muscles associated with breathing. Only extremely skilled therapists will get involved with treating the diaphragm, but very often the intercostals will be ignored and lightly brushed over by the therapist. Intercostal strains can be quite common in athletes, but problems also arise here with conditions such as asthma or when someone has a chest infection or cold that brings about a lot of coughing. This can also strain the intercostals. By releasing the intercostals, you can greatly increase someone's capacity to breathe normally and reduce the pain associated with strains. You have everything you need to know about the respiratory system, and there will be questions in your theory exam on the topic. You will now be able to complete the tasks for the respiratory system and be able to move on to the lymphatic system.